Screen visible to you?
Yes, sir.
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Okay, today's topic for the class is orthognathic surgery. We will be completing this class.
మధ్య ఒకసారి స్క్రీన్ ఆన్ చేస్తూ ఉండండి. అది ఎందుకంటే కొంతమంది మనం అడ్మిట్ చేస్తేనే వాళ్ళు ఎంటర్ అవుతారు. కొంతమందికి వాళ్ళ మొబైల్స్ అలా ఉన్నాయి. సో ఏంటంటే మధ్య మధ్యలో ఒక్కొక్కసారి చెక్ చేస్తాను, ఒక 10 నిమిషాలకు ఒకసారి, పావుగంటకు ఒకసారి, లేదంటే వాళ్ళు జాయిన్ అయిపోతుంటారు. స్టార్ట్ చేద్దాం.
Today's class for this session of 1 hour will be on orthognathic surgery. I will be mostly concentrating on the topic which will be most frequently given for you in the exam. Okay, not expanding elaborately on each and every topic. Okay, let's go to the class. Let's go to the definition of orthognathic surgery. So it's like your definition of conservative dentistry only. The art and science of diagnosis, treatment planning, and execution of treatment by combining the principles of orthodontics and OMFS. For what you are correcting? You're correcting the musculoskeletal, dento-osseous, and soft tissue deformities of the jaws and its associated structures. So the main core of our is we are using the principles of both orthodontics and OMFS to correct the musculoskeletal, dento-osseous, and soft tissue deformities. Okay, am I audible to you?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So
Sir.
let's go to the next slide, and now you can see the slide of the face of single person, which has been divided into multiple thirds. So the face can be divided into horizontal thirds as well as vertical thirds. So what you have to consider here is the in the vertical horizontal third, you need to consider the space between the upper hairline to the point junction between your eyebrows, that is called as labella, the junction between this point glabella and your lower part of nose, and from the lower part of the nose to the lower border of your chin. So all these three parts of the face should be symmetrical. Coming to the vertical thirds, the distance between the two medial canthus, the distance between these two medial canthus, the distance between these two, this is called the medial canthus, should be in par with your nasal floor, that is the nares, and should be in congruent with your corners of your ear. So all these three should line in same plane. So this is what you need to observe in the patient when you see for an orthognathic case. Okay. At the same time, interpupillary distance should be also you have to measure it. That's what next. What are the things what you concentrate in the facial symmetry is consider to the jaws. Maxilla will have vertical maxillary excess, vertical maxillary deficiency. Coming to the mandible, we have mandibular prognathism or mandibular retrognathism, or you may have a combination of maxillary and mandible both in the patient. So let's go to this diagram showing top part is nothing but your skull, and the lower part is your red part is your maxilla, and this is your white block is nothing but the dentalar portion of maxilla. The same thing holds for this. This is the mandible, and this is your dentalar part of mandible. So when you're saying maxillary excess, you can see both the dentalar component as well as the skeletal component is more ahead of your mandibular component. At the same time, so the prognathism can be because of excessive growth of maxillary part or deficiency in the mandibular part. So you can anticipate both in the same scenario. Okay. So coming to the mandibular prognathism here, you can see the diagram. Prognathism can be because of deficiency of maxilla or maybe of excess growth of things. You can see the clear cut, the clinical signs here. You can see excessive overjet in the lower of this face. Okay. And you can see a edge-to-edge bite here. Okay. In this face, you can see the excessive chin prominence here lower. So all this is a classical clinical signs for your mandibular excessive growth, or you can also suspect as deficiency of the maxilla. So coming to the orthognathic surgery, it's not based on three things. It's a triad consisting of patient, orthodontist, and orthosurgeon. So all these three things have to be collectively taken for the surgeon to operate whether what is exactly required for the patient. Okay. So as I said in the last slide, we need to consider all these things. So what we'll see in the upper third we'll see the hair loss, because that defines the point, the symmetrical point of the upper third. The next thing in the middle third, you need to show the scleral show of the patient, and the intercanthal distance is very, very important. And next is cheek widthness. It's at with 10 mm